20-year life expectancy gap from those who live east of 35 versus those who live west. That is still a reality that we have today, where your zip code is determining your health outcomes and your life outcomes. I, Vanessa Fuentes, Austin City Councilwoman, on behalf of the Mayor Kirk Watson, do hereby proclaim January 23rd, 2026 as Austin Travis County Community Health Assessment Day in Austin, Texas.
This day helps us to understand how can we help individuals that feel sick, need to go see a doctor, need medicine. How do we get those resources or those services to them? How do we get them to go to the doctor? What phone number do they need? What address do they need? How far is it from their house? And so this is some of the work that we do here, is to make sure that we understand where those resources are, where the need is, and if somebody is at their home that is sick, that they'll know that maybe there's a hospital 3 miles away or 4 blocks away, or that it might be a longer ride to get to the emergency room. So this is what we're trying to understand here.
I'm so pleased to be here with y'all. My name is Vanessa Fuentes. I represent District 2 on Austin City Council. I've had the honor and privilege of chairing our Public Health Committee on City Council, and just wanted to be here today because I know that this gathering is one that has been a long time coming. It's taken a lot of hard work and effort to bring y'all together. I know we have a lot of experts and individuals in the room who are passionate about health equity, and so I was excited to jump at the chance to be here to offer some welcome remarks. I want to thank Austin Public Health, Travis County Health and Human Services, and all of our amazing partner agencies, and of course, our community for your collaborations and insights into a broad and inclusive understanding of our community's health needs. I also want to acknowledge the times that we're in. We are watching the attacks on our public health foundation throughout this country, from proposed defunding of programs that our communities depend upon. We have uncertainty at agencies like the CDC, as well as a 10% cut to the city's social services safety net, and knowing that there are deeper cuts looming on the horizon. And so I worry about what that means for our community's health and well-being, as I know that many of those services are lifelines for residents in Austin. But when I look around this room, and I know we have a lot of great people in this room, I see our community members, our nonprofit leaders, our service providers, our advocates, and our public health colleagues. And I'm reminded that while others may debate the value of public health, you all are living it every single day. The 2025 𝗙CHA is a powerful snapshot of our community's health, focusing on equity, structural determinants of health, and community resilience, and it will tell us what many of you already know from experience. And as someone who is privileged to represent Austin and champions Austin's community health and well-being, that is something that is always top of mind. In fact, it's part of the reason why I decided to run for office in 2020, knowing the health divide that we have in this city. 20-year life expectancy gap from those who live east of 35 versus those who live west. That is still a reality that we have today, where your zip code is determining your health outcomes and your life outcomes. And for many on the east side especially, what that looks like is that families don't have access to a doctor, or they don't have access to affordable food, mental health resources, or public transportation. These are all things that we know that impact quality of life and that determine our life outcomes. So those are real barriers that we have, but I also want to acknowledge that we've made some progress here. In just the last few years, the Dove Springs Public Health Facility has opened, as well as, the Travis County Child Care Fund launched last year. Central Health opened their Del Valley Health Clinic. And 𝗏𝘗 will be breaking ground in a food desert later this year. So these wins didn't just happen by accident. They happened because of the people in the room. People in rooms like this are challenging the status quo, are working with our community members and demanding more and demanding action and demanding policy change. And so this work is so critical, especially now, which is really why I wanted to be here to present this proclamation, offer some remarks, and just say that your work is valued. And I know that the community health assessment, I'm committed to making sure it's not just another report that we have that isn't looked at or referenced. In fact, I requested a briefing and update to our Public Health Committee, which will be happening in a few weeks, so that my colleagues on council are also updated on the insights that you all are providing. And then me and my team are working on a resolution, a policy resolution on council to help guide a social service reset that the city manager is undertaking. And I wanted to make sure that was values aligned. And as part of that resolution, we will be referencing the community health assessment. So know that your expertise is valued and we are putting it into action. So with that, it's my honor to present this proclamation. Be it known that whereas the City of Austin recognizes the importance of community-driven public health strategies and the invaluable role of collaboration in advancing health equity across Austin and Travis County, and whereas the Austin-Travis County Community Health Assessment is a foundational initiative that brings together dozens of cross-sector partners to identify key health priorities, inform policies, and invest in healthier outcomes for all residents, and whereas in the 2025-2026 years, under the leadership of Austin Public Health, the CHA and CHIP team re-engaged more than 80 community stakeholders to co-design a refreshed vision for health equity with deep input from historically marginalized populations, ensuring that our community voice remains central to the process. Thank you. And whereas the CHA initiative launched an innovative health equity data hub that translated complex epidemiological data into accessible, actionable insight for both policymakers and community members. And the CH team has integrated a racial equity impact assessment into all phases of the CHA-CHIP process for the first time in the program's history, setting a new standard for inclusive, equitable public health planning. And whereas the CHA team has elevated internal systems of accountability, including monthly equity-focused work sessions, and supported partner organizations in embedding health equity into their strategic plan and performance metrics. Now, therefore, I, Vanessa Fuentes, Austin City Councilwoman, on behalf of the Mayor Kirk Watson, do hereby proclaim January 23rd, 2026 as Austin-Travis County Community Health Assessment Day in Austin, Texas.